Good morning, Monday morning to everybody. This is Steve Stites, Chief Medical Officer at the University of Kansas Health System. We're broadcasting live from the Dolph Simons Family Studio. Delighted to be back with you this morning. We have several special guests today I want to make sure I introduce. One, of course, is Hawkeye. He is not a special guy anymore. He's just Hawkeye. Another is Danielle Johnson, who is seated to my left. She's a pediatric psychologist here at KU, does a great job. She's been on our program before. You've probably heard her. Dr. Angie Myers is the Division Director of Infectious Diseases at Children's Mercy. Angie, wave to our audience so they can all know who you are. And also Dr. Jennifer Goldman, who is working on the front lines with COVID patients. Jennifer, can you wave to our audience? All right, there you go. I'm going to see, hopefully, Angie, can you hear us right now?
No, she can't hear.
Okay. We're trying to make sure we get Angie to be able to hear, because we know we want to connect with children, because there are a lot of pediatric questions that comes up, especially as we think about reopening schools. But before we begin, the Community Blood Center is holding an emergency blood drive. Joining us by phone is Chelsea Smith. Chelsea, so good to have you back.
Can you hear me okay?
The blood supply these days.
So we're hanging in there. We're still sitting around a 3 to 4 day supply of blood products. So, you know, it's better than when we first began after hospitals started reopening elective surgeries and things like that. But as I've said many times, we like to have a 7-day supply so that we're able to adequately supply, you know, all of the Kansas City area plus Topeka and St. Joe areas as well. So 3 days isn't going to cut it for us. So we are still ringing the urgent needs bell and trying to get people in the door to come donate blood.
Thank you for doing that. I do know. I mean, the efforts you all have put up. I mean, you're better. You were 2 days. Now you're 3 to 4 days. Certainly a lot better. Where is this blood drive this time?
So this time it's still in the health education building. We're going to have a drive down there tomorrow and Wednesday. This time we're on the 5th floor in the Ad Astra room. And then also there's a change in time for this drive as well. We will be there Tuesday and Wednesday, both days from 7 a.m. to 1 p.m. And as always, we encourage you to make appointments just so we can gauge the numbers that we're going to see that day.
Support this blood drive. Where can they go find out more information, Chelsea, about where to sign up?
Yeah, we encourage you to go to savealifenow.org. There you can find locations of all 7 of our donor centers, plus all of our blood drives that are open to the public like this one. So we encourage you to go online. You can use the zip code search to find a drive near you, or you can use the group name search and specifically search for KU Medical Center, and you can find the appointment schedules that way.
To the University of Kansas Medical Center for helping host that blood drive and allowing the Ad Astra room to be such an important place for this to take effect. So thank you for being with us today. Doc Hawk.
Hi.
How are we doing?
We're not doing too good, doing better than I thought we would, based on how our numbers were going up last week. Over the weekend, we went from anywhere from 30 to 35 patients in general at any one point in time here in the hospital. So we've had some discharges, but we've had some admissions. So right now we're sitting on 36 in the hospital.
Okay.
A third of those, 10 of those are in the ICU, and 6 of those are on the vent. So our numbers are continuing to creep up, unfortunately. We were hoping they were going back down, but slowly creeping up. Hopefully we do not get into that 40-50 range.
What do you think it's going to take for those numbers to go back down, Hawk?
I think it's going to continue to be based on individual responsibility, keeping out of large gatherings, keeping out of indoor spaces as much as possible. Distancing is the important part. 6, 8, 10 feet away if possible, and of course, both parties wearing masks is going to be the important thing for really stopping the spread.
Yeah, I think that's really the thing, right? You know, there's all this mask wearing, and we're going to continue to talk about it today and every day, because it really is important as we think about especially reopening schools and getting back to some educational activities for children and young adults. So that's going to be a major focus of our whole program this week, is talking about the reopening of schools. And with us today, to start with, let's turn to Jennifer Goldman. Talk to us a little bit about what's going on over at Children's Mercy. What are you all seeing with COVID? And then talk to us about the reopening of schools and what you see as a safe path forward.
Yeah, thanks so much. So over at Children's Mercy, it's pretty consistent still. You know,
most kids are not getting infected with COVID. We've tested over, 7,300 children and only had 188 positives thus far, with only 2 inpatient. So that story stays, thank goodness, pretty consistent, that children are not being impacted the same as adults with COVID-19. As we start talking about school reopening, I think, we all acknowledge that in-person learning provides opportunities and support that remote learning just can't. We know that all children have don't have access to excellent internet access and the electronics to perform the remote learning, or potentially the safe environment that's needed to stay at home and learn effectively. And then if we assume even that part can be achieved effectively, we still have, other gaps that schools provide. And so schools provide services in person that just cannot be achieved in remote learning. So these include providing nutrition, socialization, which is critical for development, and then social services. And schools are also mandatory reporters for, child abuse and neglect. So for all those reasons, in-person, education has become the hot topic, as it should. The question of, can schools get back to in-person learning safely? They can, but that requires, significant mitigation strategies. And so that's what we are working with schools as they, aggressively work on developing strategies to mitigate risk in schools when in-person learning returns.
What do you see as some of those strategies that can help you mitigate the risk?
Yeah, so you guys brought up several of those strategies. So physical distancing, so trying to remain, as distant as possible within the classroom. Masking. The American Academy of Pediatrics, recommends that masking can occur in children greater than 2 years of age. And so children can safely mask, and that should be encouraged. And then screening is a huge component of returning to school safely, and this takes a significant commitment on families and teachers and students, that if you are sick, you cannot go to school. And as we know, many COVID-like illness symptoms, since there are so many, a lot of those look like the common cold. And for children, that's going to have to be a reason that they cannot return to school until they're evaluated to make sure that they don't have COVID-19. And if they do have it, they have to isolate and stay at home. And if they don't, we have to be able to test them and then be able to get them back to school safely.
Yeah, those sound like really important thoughts.
Hello.
Hello, is that Angie? Don't know yet. Well, in the meantime, I want to turn to Danielle for a moment. Danielle, we've talked about how children can get back to school safely, but can children feel comfortable about going back to school?
That is a great question, and I would say it depends. It depends on your child, the age of your child, any predisposition to health issues, or worrisome. We have some worrisome kids that are already nervous about going back to school because what if they get sick? What if they get their family sick? What if they can't see their friends? What if all these what ifs? And so there are a lot of kids out there who worry about the what ifs, just like us adults worry about the what ifs. And so talking to kiddos, I make it clear that there are some things we can't answer because we don't know, we don't have all the answers, but these are the things I'm going to do to keep you safe. And so with my own children, we talk about, what things do we do? Mommy wears a mask to work and I wear a face shield, but these are things we do to keep ourselves safe. And when you go back to school, you'll do things to keep yourself safe. So having some really age-appropriate conversations with your children about what things we're going to do to keep you safe if a parent decides to send their children back. I know there's some parents who aren't comfortable with that, and that is okay. It's doing what's best for your family, but having things in place to keep you safe, whether you're at home or you're at school, to help minimize some of the worry that children have, and frankly, as parents have about the what ifs.
So were your kids concerned about going back?
My middle kid was concerned about going back. He does not have to wear a mask. My older kid has to wear a mask at her school camp. And my older kid wears her mask, she dons and doffs it. We talk about how do you clean your hands before and after. And she really gets it, and her friends all get it, and they all wear their masks. My middle kid, who will be a kindergartner, is more concerned, and so we talk about things to keep ourselves safe all the time and say, you know what, mommy and daddy's worry about the big stuff. You worry about like being a good student and learning your ABCs, which seems to work because we let him know that as adults, we'll take care of all the big stuff. And this is his role in this, and that's to wash his hands. If he sneezes, sneeze in his elbow, teaching him the basic hygiene things that he can have control over. So making sure that our kids have some level of control of the things that should be in their purview to have control over. The big stuff, we'll handle it.
All right, good luck. Would you come over and take care of my house? Because I sometimes don't do big stuff either. All right, so let's see if we have Angie here. Angie, are you on?
No, we're still having
We're still
struggles
struggling.
with that.
Oh, man. Okay, we'll make sure we get her back on the show at some
It was
point.
fine before we started, and then we
I
just
know.
lost it.
I probably got in the room and somehow the whole thing went
Yeah,
down with
you
that.
gotta
so.
love technology.
That's it. Well, let's see if we have questions from media this morning to direct toward our panel. Not hearing any. I'm going to turn to Jill because I bet there are already a lot of questions out there, especially about returning to school.
Yeah, I'm going to start with Marnie because I think it's an opportunity to kind of clarify some perhaps myths. If people are getting the virus a second and a third time, so that's a clarification.
Yeah.
Thereby not building up antibodies, what makes us believe that a vaccine would work? Yeah.
We'll start that with Dana. And Dana, first of all, it's a bit of an assumption to say people are getting it a lot the second or third time.
Correct.
There may be the rare person who's doing it. I don't think that's very widespread, though.
Yeah, I don't think, I agree with you. There are a lot of questions in that one question. I agree with you. I don't think we have evidence about reinfection a second and third time.
At least not frequently. Well, I've heard there are a few people we've seen, but that is a rare circumstance, not a common circumstance.
Right, and we really need to prove that and get the studies to prove that. But we do know, again, we know you can have the common coronavirus that causes the common cough and cold, of which there are 4. You know, we know that you can get that several weeks later to several months later. But the issue is, are you building up immunity? Do you have any immunity to either keep you from having any symptoms or having mild symptoms if you do? We certainly don't want it to go the other way, that you have actually an enhancement. So I think we are still looking at that. But we know from the common coronavirus that you can get it again. The other thing with immunity that you talked about, we absolutely have found and know and understand that people have recovered from this coronavirus, from SARS-CoV-2, and don't have detectable antibodies. But what they do have is T-cell immunity, so they have other immunities. What we are seeing from the earliest studies that we have in these vaccine trials that are going on is they do seem to induce a little bit of that T-cell immunity as well. So we're hoping that that happens. We know that for a good vaccine to really take and give immunity, we know you need the antibodies, but also the other component, the cellular component of immunity, the T-cells. So we are hoping and think that that does look promising right now as well.
Yeah, I was going to say there's some really good news on the vaccine front that was published in, I think, the New England Journal of Medicine a few days ago about some preliminary trials. That's really encouraging. And so saying that, gosh, good response in terms of the antibody and T-cell immunity all wrapped up. And, I mean, that's really encouraging news. Jennifer, you mentioned earlier that young people have not been as positive as children. I know there's been some data and some suggestion out there that the really young don't spread the disease. You have to be like 12 or 14 or 10 or whatever to start spreading the disease. Talk to us about why that might be. What does that say about the safety of reopening schools, if it's true?
Yeah, that's a great question. So there's been a lot of data. The most recent that just came out from South Korea, looking at thousands of cases and then looking at both household contacts and contacts outside of the household and looking at kind of rates of transmission. And what they found is that kids 9 and under really had very low transmission rates, even within the household, where you assume that physical distancing and masking is not occurring. And older children, so 10 and above, do look like they can transmit it, similar to adults. So, that means a couple of things. Again, in children, we're just not finding the virus as commonly as we do other viral infections in children. And this may have to do with the enzyme that's needed for the virus to actually enter the cell, and that may change during growth and development. Children may just not, younger children especially, may just not have the strength of cough production and things like that to be able to spread it. And so again, as we think about returning back to school and our mitigation strategies for younger children, especially if they need to read lips and look at facial expression, because that's a critical part of development and learning, especially in very young children. They likely don't have the capabilities of spreading the illness as older children and adults do.
Danielle, does that make you feel any more comfortable about your kindergartner going back and thinking, okay, well, maybe that's even better than I thought it was?
Yes, and to be kind of looking at the literature, we know kids need social and emotional support. Being in school is vital for their academic development, for their emotional development, and things that we can't replicate at home. So by kind of nature and design, having kiddos in school, if they are healthy and the school can social distance, is the safest place for them to be. As far as them being able to have access, I think our Children's Mercy colleague mentioned safety issues. We've seen the number of mandated reports drop tremendously. Kids aren't in school, so safety issues aren't coming up. Kids have access to food and resources because they're not in school. So having them in school helps take care of a lot of things, in addition to academics, but the emotional piece, just missing their friends. For having kids home for the last almost 4 months, they've missed their friends. Some kiddos that functioning just beautifully well, and then March hits and they've been home for months, they're sad and mopey, more irritable, they're having temper tantrums, and they haven't had temper tantrums in years. So we're seeing our kids regress, and if we can find a way to have them at school safely, I think for not only them, but for families, it's a very good option for families that need to work and be outside of the home. Having their kids somewhere safe is
It's a big deal.
It's
Are you seeing
vital.
more increases in calls to the suicide line around
Yeah.
children, and also about violence, et cetera, child violence?
We've seen an increase in not only the suicide hotline numbers, but the attempts have been more serious. So kiddos are doing more serious things to attempt to take their life. And working in patient psychiatry for adolescents, I get to talk to kiddos and kind of get some understanding of what's different, why now. And a lot of children are pointing to the impact of COVID on their family's finances, on their ability to see friends. If they have an issue at home and the consequences, they lose their electronics, they have no means to reach out to their friends. They've lost contact at that point,
Right.
Which for a 14-year-old that's their life right now. And so having the lack of access to electronics, which means lack of access to friends, is really impacting our kiddos. And they are having less of an outlet to even talk to people. So if you lose your electronics and you don't have a relationship with your parents, you're in a very tough spot. And if you have any kind of predisposition for depression or anxiety or history of self-harm, that really kind of raises the risk factors for acting on thoughts that you may have had, but now you've got the final piece to send you over to act on that thought.
So that is tough. Jill, other questions?
Yeah, Tracy and Stacy are asking sort of the same questions. They're pointing out that corporations are meeting at home and having their employees work from home, and they're concerned that schools, they hear you say, if you wear a mask, if you social distance, if you wash your hands, 3 things they think that kids aren't going to be able to do. They want to know, why do people insist on going back to school? You gave some answers.
We just talked about that a little bit. But Jennifer, those are important rules every day now in society. It won't be just true for schools. It's true everywhere.
Absolutely. I think, as brought up a little bit earlier, schools, though, are probably one of the places that those behaviors can actually be monitored pretty closely. And as we all know, children are very good and actually like routine. And so setting expectations early and often at the schools of face mask wearing, hand washing, social distancing, it's been proven that it can actually be done. Our European colleagues have gone back to school. Our Australian colleagues have gone back to school. And many schools, even in the metro, have, started and have resumed summer school. And so I think we know it can be done. The message is that we have to be committed to our kids, our parents, our families, and our teachers and the school staff that we will do it. It's not optional. And that's really a commitment for every family to recognize that we're gonna screen our kids before we go to school. We're gonna, wear masks appropriately and encourage it. We are gonna hand wash in between every class and when we go outside and come back in. And then we're gonna do a lot of things within the school that have been shown to be effective in reducing risk of COVID-19 spread.
Yeah, so important, isn't it? Please.
I would add the idea of modeling. So for our kiddos, we model behavior. Schools are a great place to model behavior because they have 10 to 20 peers who are doing the same thing. And so there's some idea that they're being socialized to do these things, washing their hands, covering their mouth. I think most parents would say their kiddos tend to do better with following rules at school than they do at home. They've got some level of pressure from their peers that are all in line to follow. So in school, they get to model, and the teacher gets to model what the expectations are, that they follow better, I think, than they do at home, quite frankly.
And it is interesting to note that as children went back to school in Europe, or back to school in Australia, or in Korea, they didn't see a massive outbreak from that. So it feels like it can be done safely if we follow the rules.
To that point, Tara points out that those countries had more containment when kids went back to school. Should we go back before we have containment here in the United States?
That is a really knowledgeable and great question. Okay, what do you think first, Dane? And then I'm going to skip over to Jennifer and see what she thinks too.
You know, we are just seeing the virus explode, and we see new changes every day, new amounts of total daily deaths, new amounts of total daily cases. We know that we are testing one of the highest per capita in the world. So the unfortunate thing with that is the percentage of those tests is much higher than a lot of places in the world. So I don't know that we are going to be able to temper down those rates anytime soon. We can start, and we have been really endorsing and wanting people to understand that. If we can start everybody masking and everybody distancing, we can try and decrease that as much as possible, but I don't know that we would get it to be decreased in the amount of time from when school is supposed to start. So that's a very good thing. And that's why it does take the administrators and the teachers and the routine that you were talking about to really help direct that so that kids can model after that and do all of those things, because we really do need to get kids back to school.
We do. Jennifer, what do you think? And talk to us a little bit, as I know a lot of districts have now delayed the opening of school past Labor Day, in part, I think, in response to that outbreak. Do you feel like we can do this safely at this time?
Yeah, so there's a couple of really important points to take home here. We know that in areas in the United States where rates were extremely high, such as in New York, essential workers' kids still had to go to daycares and things like that. And despite thousands of children being taken care of during very high rates of infection, there were not significant outbreaks noted. So again, that highlights some of the differences between children and adults when we're talking about COVID-19 infection. But a really important point to all of this is mitigation and decreasing risk is the first part of what we need to do to make schools safe. We also need to be able to test both staff and students rapidly if they exhibit COVID-19 symptoms to be able to contain any infection, because there are going to be positive cases in the school, especially when community rates are high. And many of those cases, often coming from adults who potentially come into the school. As we know right now, the highest rates in our metro area are the infections in the 20 to 29-year-olds. So recognizing that community spread absolutely plays a role. Nothing is going to be 100% safe, but the mitigation strategies and then being able to test rapidly anyone who's exhibiting symptoms, place them in, isolation if they are indeed infected with COVID, and being able then to contain, to quarantine people that have been exposed in the schools. With all of that, yes, I think we can contain and get kids back to school safely.
Sense. And speaking of those 20-year-olds, 18 to 22-year-olds heading back to college, Dana, we're working hard at KU to make sure that stays safe. I think we made some big headway. Big event happened this weekend because Quest got pooled saliva testing.
Yes.
Approved by the FDA.
Yep, we got the FDA approval, not we, but Quest, and the EUAs are gone out. So that will really help greatly with testing as far as really any entity goes, but specifically for this, we're talking about college campus, specifically KU and Lawrence. So that will be very helpful.
Lots of kids coming in all at once. You're not sure what disease prevalence is. You get that started, quarantine early, and try and help people stay safe.
What is an EUA?
It's an emergency use authorization. It's just a temporary thing. You still need to submit data. The FDA still has to approve it, but in these times of pandemic, it's just a kind of a fast track way to start something, get it out there so that people can utilize it.
And you have to pass, there are standards you have to pass. You just can't make it up and wave
Correct.
it on. You have to get those standards passed. You pass it, then it says you got to keep reporting on data and sending it back to the FDA. And they're going to make sure that it does what you said it's going to do. And they require you to run a lot of tests along the way to make sure it's safe. And there's a lab here. We're working with Clinical Reference Lab where you're pretty certain. We know they've got their pool testing thing, and now they're trying to look at home testing kits. So that could be pretty exciting.
Yeah, we were talking about that this morning on our health partners call to really get college-age students back to campus safely and keep them safe. And as you said, when they get there, make sure that it's not there on initial evaluation, and then hopefully keep everybody safe moving forward. But then again, as you are going throughout the year, the school year, have the ability to get those rapid tests and those adequate tests so that we can really try to temper any outbreaks or clusters or anything like that going on.
This might be a question for Dr. Myers, who we now have by phone.
That's right. Dr. Angie Myers, just to say, is the division director over at infectious disease at Children's Mercy, and we apologize. We know we had a struggle with the visual connection. We have our audio connection. She's on the line now. So welcome, Angie. Thanks for being back on our program today.
All right. So this mom had a child. So this mom, Dr. Myers, had a child that 2 years ago had Kawasaki's disease, and she cleared it, but now she's concerned that her child might be more susceptible to COVID.
Yeah, Angie, they asked us that question on Friday, and we clearly punted that till today because we didn't have a good answer at all.
Okay, no problem. So, I understand this mom's concern and fears, but we have not found that children who have KD once are more likely to get it again, nor should they be more likely to get COVID disease. I know that there's been in the media, there's been a lot of discussion around the multi-inflammatory system illness in children, and there are some features that are similar to Kawasaki disease, but it is a separate entity. It does appear like it happens, 2 to 4 weeks after having COVID infection. And even though there's some overlapping clinical signs and features, they're not related to Kawasaki disease. There's a definite different entity that's happening.
When it does happen, how easy is it to treat? How do kids do with it?
So far, the kids that we have had with the multi-system inflammatory syndrome have done really well. We've had a total of 8 children in our hospital that we've treated, and by and large, they have, even if they've needed to go to the ICU, they have turned around really quickly with therapy and have been able to be discharged home and are doing well.
Great. Well, that's good to know, and it's good to know that they're not at risk just because they had Kawasaki disease once before. So, Jill, other questions?
Yes. There's a mom that's wanting to know what happens if the child she has to care for is young enough that and gets COVID, and she has to care for it. She can't say go to your room and isolate.
Mm-hmm. So a young child has it. Yeah. So a young child gets COVID disease. Angie, what are your thoughts around that? What does mom do?
That's a great question. So we know that young children, based on the available literature right now, appear to be less likely to transmit infection to adults and to each other. That said, it's still a good idea for mom to be careful in terms of cleaning high-touch surfaces and in terms of frequent hand washing. And although it's very hard to limit your exposure to a young child, right? You have to care for them, and they need hugs and cuddles and all of the things. But it is still a good idea to consider doing what you can, and certainly not kissing on the mouth or the face or any type of thing that might share any type of secretions, so drinking after each other, things like that. And again, frequent hand washing, cleaning high-touch surfaces, and depending on the age of the child, that you may consider wearing a mask at home too.
Danielle, I would think that child's got to have love from mom and dad, even if they're sick. Yeah. So this part of this is you're going to have to roll the dice a little, I think.
Correct. I think, for parents that have had kids with the flu, and if you've got multiple kids in the house, you don't want the flu to spread in your house. So what things did you do when your kid had when 1 out of 2 or 3 or 4 had the flu? So making sure we still give cuddles, but as Dr. Myers said, being safe. And so having a kid in the past that have had the flu, she had a mask and she was kind of quarantined to her room, and we all went, well, not we, one parent went into her room and took care of her. So being mindful and trying to maybe keep the kid more secluded from the rest of the family to not spread it, but also as a parent, your kid still needs the loves and hugs even more so when they're sick. And so taking that time, and maybe one parent becomes the potential parent to get it, that's the parent that's going to always take care of that kiddo. So I think by default for most families, when a kiddo gets sick, there's usually one parent that becomes the carer of the sick kid. So
you know, when I get sick, my wife says I turn into a baby and I want a lot of attention. I think, you think that could be true? I don't know.
That's a possibility. Sometimes that happens. Sometimes that happens.
I need the hugs and cuddles too when I'm sick.
Yeah,
everybody does. Everybody does. That's it. That's the deal. All right.
I'm not a doctor, but I think that might possibly be a guy thing.
Oh, listen, I knew someone was going to bring that up.
You're right.
Yeah, okay, fine. Regression.
All right, yeah.
I regress every Saturday when I go to the fly fishing shop. Let's go.
Stacy has a question about what about vulnerable teachers who have vulnerable families who teach kids over the age of 9?
Yeah. That's going to be tougher too, Dana, because there are kids out there, or adults out there who are like that. But you know, I'm reminded of the information about the hairdressers down in Springfield, where if you did the right stuff, there was 0 transmission.
Yeah, absolutely. If you can, you know, and we understand that some of these higher populations of vulnerable people will also be teaching children with special needs. So we've talked about earlier, she had talked about you need to lip read, especially for the younger ones. But if you're teaching children with special needs, you may not be able to wear the mask. If you can, as much as possible, again, stay separated, 6 to 8 to 10 feet, if that's reasonable. If you can, wear the mask. Take all of these basic pillars that we have talked about and really try to focus them to your particular practice or your particular job, really so that you can teach the children, but also so you can stay safe.
And Jennifer, I would think that trying to make sure you follow the guidelines, but also knowing that children may not be as symptomatic as adults, meaning that you're going to have to take those precautions whether you think somebody's sick or not.
Yeah, you hit the nail on the head. Screening is really only one of the many steps of kind of these safety mitigation strategies we're talking about. So you're talking about screening for symptoms that may suggest that a child or teacher is ill, but then you also are doing all of these other things because we know that screening's not 100%. So then you're wearing your mask, you're washing your hands, you're physically distancing, and all those things together, decreases risk. And so you've got to do them all.
Yeah, so important. Jill, another question.
Yeah, Amy asked this. If schools were shut down, kids were mostly isolated in the beginning. Could that be a reason why kids weren't contributing to spreading the virus?
Yeah, that is an interesting question, Angie. What do you think when schools shut down? Did that help prevent kids from spreading the virus, or based on the Korean experience, is it just that kids just don't spread it as much?
Yeah, that's a really great question, and there's some data out there that suggests it could be either way. From the Korean experience, it definitely looks like children under the age of 10 do not spread it as much as older kids and adults. So the household attack rate was around 5% for kids under 10, but it was higher. It was around 18% for kids above 10. So that gives us some data in a time even when there was social distancing in place and there were school closures. There's other modeling data that appears that, closing down schools doesn't contribute as much from a societal standpoint as does social distancing and universal mask wearing. So it really does depend on what data you're looking at and really what other mitigating factors are in play at the time. So what we think at this point is that universal mask wearing when out in public and continuing social distancing and not having large gatherings actually may be the biggest contributor to decreasing disease transmission.
Danielle, okay, here's the hard question. You're going to get the hardest question today, and I've not figured out how to answer this. So my wife walks into the Price Chopper this weekend, security guard, didn't have a mask on. How does that happen? Was trying to wear a face shield, and then so my wife was trying to say to him, hey, you should have it, and then didn't get a very good answer from him. How do we convince people to wear masks? What is this that we're so hung up about not doing it?
That is a beautiful question, and I know being confrontational does not work. And so that never will get you anywhere, and trying to convince someone how wrong they are for not wearing a mask or for wearing a mask never works. But to be able to say, you know what, I'm trying to keep myself safe, and it would be amazing if you could do this for me. For people that we know, and I think people have lost some friendships over to wear a mask or to not wear a mask. And so I think if we address it from, I really care about my health, I care about your health, and so these are things that we know can help. Would you mind putting your mask on? There was a post recently at a Gainport gas station in which the employees weren't wearing a mask, and so a customer said, could you, it says, it's recommended, it's mandated, you should wear a mask, and the employee said, well, I don't have to because my boss said I don't have to. And so that person said, I'm going to not come back until you guys can get this really figured out, because I want to support you, but I can't support not being safe. And so they wasn't confrontational, but just kind of educating them on what I need to be a customer of yours. And so from that standpoint, I don't know if that employee really heard the message, but if we can really have some conversations about wanting to protect ourselves, protect the people that we care about, really get through this much quicker. I think if we can kind of let people know, this will decrease numbers. This will let our lives go back to more normalcy sooner if we can just all work together, because we can get much farther if we work together versus having our kind of siloed camps in opposition.
Jennifer or Angie, you all must have had to spend some time trying to convince kids or your patients to wear masks. What do you say?
This is Jen. Yeah. So we, again, in the hospital, every child, greater than 2 years of age wears a mask. And as mentioned earlier, kind of setting the expectation and modeling, there haven't been large challenges. Kids look to adults and their peers to see what is the right thing to do. And so, and we also know, as some schools have resumed, even in the area, young children are able to wear masks all day long. And so I think there have been many, fun videos going around online showing how children don and doff masks, talking about maybe put on your superhero mask for the day and make them feel like you're doing something good for the greater good, can really have an impact and convince kids that it's no big deal, and they're actually a lot more flexible than adults a lot of the time. So they've done very well.
I'm going to bring my superhero mask in tomorrow and wear it, providing I can remember this to do this, because it's all about Star Trek, and I got my Spock mask, and you're going to see it tomorrow.
Allie and Leanne want to know, what kind of PPE should teachers be wearing in the classroom? And Leanne wanted to know if the doctors at Children's have those clear face masks. I wondered if that was good for teachers.
All right. Angie, do y'all have the clear face masks?
There's been a lot of discussion around clear face mask at our institution, and I know it was being evaluated for the speech pathologists, occupational therapists, and I think in that sense, yes, but for routine healthcare workers, we're wearing routine medical grade masks.
And Jennifer, talk to me a little bit, or talk to us a little bit about the first part of that question. What do teachers need to wear to stay safe?
Yeah, that is a great question, and so important, because we have to keep our teachers safe. So they need to be wearing masks at all times. And again, then trying to achieve that physical distance, of 3 to 6 feet away from their students. School nurses need to be equipped with full PPE, especially in the setting of where they would have to, provide aerosolized nebulizing treatment to a sick child. They need to be able to have medical grade masks, face shields and gloves and all of that. And so it really depends on what you're doing, but all teachers need to wear masks and then maintain, physical distancing.
Yeah, Dana, any other thoughts? What about goggles for teachers?
Yeah, so we have to understand, and let's reset this. We have always maintained that wearing of the face mask is to help protect other people. Now, there is data to suggest that any face mask, even the cloth face mask, will protect you as well, the wearer. So,
not like a N95, but a little protection.
Just a cloth face mask, as recommended by the CDC. That being said, there was a very good opinion piece by Dan Diekema up at University of Iowa, who's a very good infection preventionist, who was talking about face shields, which are these welders type shields that are plastic face coverings, who said that maybe those are okay, but I don't think the science is there to back that yet. And in that case, you can see the person's whole face, and you can see their mouth, so you can lip read. But is that going to be enough to protect all of the droplets from coming out? So certainly that still needs to be investigated. But the other thing about eye protection, I think eye protection is very important as well. Again, with a face mask, you're covering 2 of your 3 mucous membranes, your nose and your mouth. There still is the eye. So going out to the hardware store or getting protective goggles is not a bad idea. I would certainly endorse that. It may not be needed, but certainly it'd be one more thing of added protection. And you got yours.
And
at the
I
hardware
always
store
carry mine
or
with me
Amazon.
because, by gosh, when I go out and see patients, guess what I got on?
Yeah.
I got on my goggles because it does make you safer. Jill, time for one more question before we wrap up.
Yeah, and then we want everybody to know we're going to do this all week because they have great questions. Ashley has one. She says, what about high-risk students returning to the classroom? Anything from asthma to more medically fragile children. What is your advice?
Angie, what do you think about those fragile kids coming back to school? Anything special for them?
So that's a wonderful question. So what it appears in the literature right now is that actually children with asthma are not at higher risk than children who don't have asthma in terms of getting infection at all. The other things that we have been learning recently is that actually children who have transplants, so even immune-compromised children, appear not to get worse disease than kids who are otherwise healthy. So there are some instances in which kids have comorbidities like they do in adults. So having obesity is definitely a risk factor in an older kid. And there are, heart disease is definitely a risk factor. But it appears that otherwise healthy kids with asthma or kids who have had a transplant but are doing well actually do really well with COVID infection.
All right, well, that's good news. Well, Jennifer, final thoughts on today and what you're thinking about what's going on out there and about schools and children and COVID-19.
Yeah, I think as we start thinking about heading back to school, children and teachers really have to be at the forefront. I think that the gaps that we really need to start thinking about and filling is how we can test children rapidly if they would exhibit symptoms of COVID like illness, because again, in children, that looks like so many other things. And we have to have a plan in place that when there's an infection in the schools, how we are really going to contain that rapidly and get children or teachers isolated if they need to be, if they're infected, or get them back to school safely if they don't have infection. So that needs to be a real priority.
All right, well, Angie and Jennifer, I want to say thank you. KU and Children's have a great relationship, and this has been just emblematic of that. Having you on the program has meant everything. I know we're going to want you back because we keep having all these same questions. And Angela, we're sorry the connection didn't work out, but it's been great to have you on even by audio. Danielle, final thoughts today. This is a big topic, and people have a lot of concerns, and they keep talking about it.
Parent, talk to your kiddos. Have ongoing conversations about what your kids are concerned about. Talk to them about what you want them to be able to do if they go back to school, when they go back to school. Check in with them on a regular basis. Model the expectations for when they go back to school. So wash your hands frequently. When you go to the store, make sure you put on your mask, but begin to model those things we expect our kids. Make sure that they know they're going to be safe. If they have any concerns, that you're going to be there for them. And really validate concerns that they have, because their concerns are valid. This is a scary time, and so to be able to acknowledge this is scary, but as adults, we're doing the best that we can to keep you safe. So have those ongoing conversations, validate their fears and concerns. Make the plans now for when school starts back. So to get their backpacks ready, to do all those things you would normally do in August to get ready for school. Do those, but just add the modification of having the mask there, their big bottle of Purell, and those things they need for school to be safe, just like they need their backpack, their pens and pencils and books.
So thank you again for being on our show. Always a pleasure and always welcome to come back. Hawk, final thoughts today?
Yeah, to Danielle's point, coercion doesn't work. And we talked about, it's not good to get in an argument with somebody. You can appeal to the science. There's excellent science that says that wearing masks and the distancing works to stop the spread. You can appeal to their conscience and consideration for other people, their fellow Kansas Cityans. And then the other thing is the businesses. The businesses have to do it. We know that there is a very good culture for that in Colorado. You can't go into a business without a mask on. The last thing that nobody wants is for it to be mandated by our leaders. So that's the way it's going to have to go, because we do see that people aren't wearing that. But there are ways to do it, but getting into a shouting match or an argument with somebody is not the way to do it, to your excellent point.
So, you know, tomorrow this topic about youth continues when Dr. David Smith, who is our medical director of youth sports medicine, joins us to talk about what we've learned over the summer and how we're going to try to navigate fall sports. You know, mask wearing's a funny thing. It somehow has struck that American chord of individuality, and it almost feels like we're at an internal battle with our souls just over wearing a mask. The hard part is that wearing a mask isn't really a political issue. It's an issue of science. We're going to try and find some ways to demonstrate that to you in the coming days so you can help spread the message, because there really is no more single important thing we can do to bring COVID to its knees than to wear a mask, wash your hands, and socially distance. But wearing a mask is really part of it. You're not going to die from carbon dioxide poisoning. Just remember, surgeons wear their masks in the OR for 24 and 26 hours at a time, and they're not dead. So you're not going to die from wearing a mask, but you may die from not wearing a mask. And that's really the important part of this story. Don't let COVID bring you to your knees. Make sure that you take those things that we know work and listen to the science, and let's get going. Hey, we have a special video for you today. We've talked a lot about how students may be asked to wear a mask at times while in school. Educators ask that you may help them by teaching your children how to get comfortable with a mask. Here's a video that may help, and we close with it today. 7-year-old Sunye says, "This is how you wear your mask." We'll see you tomorrow. And until then, stay safe, and remember, there's still no place like home.
Hi friends, I'm Sunny and I'm 7 years old. Do you know you can stop spreading germs by wearing a mask? Sunny says, make sure you wash your hands or use hand sanitizer before you put on your mask. Take the loops and put it around your ears. Keep it over your nose and under your chin. Don't touch your face. Remember to use hand sanitizer and grab by the loops to take it off. Sunny says, place your mask in a clean bag when you're not wearing it. Make it fun. I made this one. Tell your friends it's cool to wear a mask. Sunny says, get ready for school by wearing your mask out with mom or dad. In the car, outside, and around the house. Good school habits start early, so get your rest and start wearing your mask. Sunny says,